So somebody sent this to me. It's called Depp Fans Are Flooding a Psychiatrist Page with Negative Reviews After Amber Heard's Team Called Him as a Witness. Now, do not worry. We're going to watch this stuff on it. But I'm curious because from what it sounds like right off the jump, it sounds like this guy just did his job and people are hating on him. Okay? We're going to watch the specifics, but, you know, there does seem to be a pretty crazy... It's his job to try to be objective. I don't know if he is objective. We're going to listen and we're going to give our opinion. A lot of people in the chat are like, no, he was terrible. He was doing a bad job. No offense to you. I don't believe you. Because this case, this Amber Heard Johnny Depp trial is insane. Okay? They're both toxic. Seems like Amber Heard is worse. But the public narrative doesn't leave any room for any nuance. You guys just don't. Okay? All right? We're gonna read into it. Right? So that's what happened. This is the article. We don't really have to read through too much of it. It looks like this is his reviews, though. Dr. David R. Spiegel. He's got a 1.3 now. Apparently, they got rid of most of like the downvotes and whatnot. He had like a pretty good review before this. So yeah, my dog stepped on a bee. Okay. Scary. Honest, this doctor seemed iffy and scary. Okay. So let's see if, from my perspective, let's see if it's actually justified. Terrible doctor. I don't recommend. After what I've seen on TV this afternoon, I'm in the UK. I wouldn't go near this man. Something didn't look right with him. He was very arrogant and looked like he was having some kind of problem. Okay. Wow. Very unprofessional and arrogant. Okay. So yeah, we'll have to reopen that tab. All right. So we have two things here. We have the quick rundown of this physician psychiatrist on Johnny Depp's mental health, and then we have the full cross-examination. Right? I don't think that this is included in there, so we're going to start here. So let me just set this up. And while we're doing that, of course, we are going to try to beat the Balloons TD6 boss that is bugged this week on elite mode. So it's going to be quite fun. So let's start off with this here. They're discussing, okay. This is Dr. David Spiegel. That's a dog. I used to have a dog. My aunt and uncle had a dog named Spiegel the Beagle. Anyway, David Spiegel discusses Johnny Depp's mental health.
So, in my opinion,
I'm going to turn it up.
Based on my review of the evidence, based on my clinical experience, based on my publishing experience, based on my teaching experience, that Mr. Depp has behaviors that are consistent with both someone who has a substance use disorder as well as consistent behaviors for someone who's a perpetrator of intimate partner violence. So again, in terms of the acting part, we do know...
And really quick, I get that. He does seem to have, and from what I've seen too, they both seem to have substance abuse problems. Listen, Johnny Depp isn't an angel. I'm not saying that she's not worse, but I wouldn't be surprised if two toxic people found each other. So far, okay, I see where he would come from with that. Because a lot of people are like, if you don't think Johnny Depp is an angel from heaven, then you're a piece of shit. Like, that's the reality. That's how people operate right now.
That he needed his lines fed to him for movies. Part of that could have been also due to, and I don't know which movie, and please forgive me about that he actually confessed he did a movie entirely wasted. So I imagine it would be...
And I already know people are going to be like, oh, you're a victim of... I'm not. If he is a victim of Amber Heard, which there seems to be solid evidence of that, the fact that he may also have like bad tendencies doesn't mean that he can't be a victim. But it also, like, we have to keep in mind that, like, it doesn't make him fully innocent. Right? There could be a lot more going on here than we think, and we have to listen objectively. Okay? That's all I'm saying. And just try to suss out what's going on. That's why I'm not like super big and weighing in on the trial. Everybody's like this is the problem. Most of you guys are getting your information from other people on social media who don't give a shit about any of this. They don't care about any of this. It's other bigger content creators who are using this because it's popular to talk about right now. That's it. No offense, but like, you know, Asmongold, for instance. I like Asmongold. He's really good, but like, what, it's fucking 24/7 coverage of a trial. Like, you know, what's special? Like, what do you do? This isn't a topic that he ever engages in. And I'm not like a professional, but we engage in like nuanced topics and we're always trying to learn every single day. You know what I mean? And I'm just saying, like, what do you think that there's a lot of, like, for me, there's an investment when I talk about topics of like trying to get it right and educating myself. Most people don't have that investment. Most people are just like, hey, it's a popular topic, let's talk about it. And the public narrative right now is that like Amber Heard is the worst thing in the world and Johnny Depp is completely innocent. So they kind of run in that direction. So there's not like a lot of like, there's not a lot of analysis when it comes down to it. That's all I'm saying. Okay.
Harder to do that. Additionally, like I said, when I looked at deposition, you can tell that the processing speed was down. His thinking rate was down. If your thinking rate is down, and I'm not talking about, again, I'm getting older. I'm probably not as sharp as I was at 25, okay? But I'm talking about so slow that when we're trying to move on to other questions, we're still trying to answer the original data that's presented to us. So attention span is very much impaired. And if your attention span is impaired, your memory is going to be impaired. It is inescapable that that's going to happen. So all that comes into play. And that's what I witnessed in the video deposition. Fortunately, for Mr. Depp, I do see that during this trial, his cognition has improved somewhat, which will happen if you are sober. So I commend him on that. But again, I'm specifically referencing the time with Ms. Heard's and Mr. Depp's relationship. So we're talking about that.
And you could make an argument that the reason that Johnny Depp may have been so drunk that time is because he was so miserable with Amber Heard and she was abusive. I don't know if that's the case. Again, we're waiting for the trial to finish or somebody to do a recap on it before I give my expert opinion. But it doesn't, just for context.
During the video deposition, what was readily apparent was a gentleman who had a significant delay in processing speed. And like I said, when you have a delay in processing speed, many other cognitive functions are going to follow. You're going to be impaired attention, concentration, memory. All that's going to happen. In terms of having to, the speech process, if you heard the deposition, the way the thoughts were conveyed were much more in the way of kind of disconnected, disjointed statements. It wasn't that they were not necessarily understandable, but they didn't have any coherent pattern until he was more structured of his Bredhoff to kind of get to the point of the question, which happened throughout most of the deposition. And so you could see there that there was obviously some form of cognitive issue that should not be happening in someone in their mid-50s, and probably due to the alcohol and substances.
What, if any, record evidence do you have that correlates with Mr. Depp being narcissistic?
Well, I do think that the fact that he thought that Amber owed him, Ms. Heard owed him.
Objection, Your Honor.
Overruled. Thank you. Go ahead.
The fact that Ms. Heard owed him and only wanted to be together with him because of his fame is an example of that.
I mean, I don't know the specifics. It's possible though. Let's not pretend like people don't gravitate towards successful people. And women do tend to gravitate towards more successful people more than men do that. For men, for a woman that's more successful than them could even be seen as a negative for them sometimes because it could be a question of their masculinity. But okay.
I think the jealousy aspects are an example of that. I do think, as I think Mr. Tillett had testified that, being admired is one thing, but then behind your back saying something else about people is another thing. And I can probably say with a reasonable certainty that.
Why would that make him a narcissist? I mean, there might be more context there, or this could be an example of people not understanding celebrities, right? So you could be like, oh, that doesn't make me a narcissist. It's okay, this guy isn't a celebrity. Most people aren't. So it can be it's difficult to communicate a celebrity status perspective to people who aren't celebrities. And most of the time, when we talk about celebrity status, making people act differently, usually you don't use it as an excuse. So I'm just bringing that up. Yeah.
To some degree, this whole trial is that.
Did he say he was a narcissist, or did he say that he might be exhibiting narcissistic behavior in some capacity? Because I would argue that celebrities tend to generally exhibit narcissistic behaviors. No, is that an unreasonable thing to speculate on? Because they're famous.
Objection,
yeah, you're a celeb. Awesome.
What's the objection?
That's not record evidence. Speculation.
Please continue.
That this whole trial, in terms of narcissistic insult, is what's going on.
Well, why don't we talk about what you just testified to? Because I didn't ask you anything about that. I asked you whether, under this rubric, under this principle of medical ethics, have you acted unethically? Yes or no?
No. As an expert witness, I have not acted unethically. And if you want the jury to believe that expert witnesses are unethical, then I guess that's for them to decide.
Yes or no, sir. You said no. Let's go to the next question.
Okay.
All right, so it sounded like they threw a little bit of a teaser in for this part here, which is the cross-examination. I didn't know if that that aspect was the first part was going to be in there. when it comes to this. But like now we're gonna watch cross-examination. We're also gonna turn it up. Don't worry.
Sir, I'm Wayne Dennison. We haven't met. But let me ask you, let's start with what you finished with.
I'm sorry, one more time?
Let's start with what you finished with. You understand that the court was twice asked by Ms. Heard's counsel to order a medical exam of Mr. Depp, and those motions were denied.
I think your team told the court you didn't want to have them, and the court ruled on them. Right? I don't think the court proactively did it. You kind of had a motion to them, right?
No. When Ms. Heard's lawyers moved for them and asked for them and did not get them. Isn't that right, sir?
If you're saying that's what happened, my understanding of was that you all did not want him to undergo one. They petitioned for it. The court said no. Yes, that's what my understanding of it was.
The court said no to ordering Mr. Depp to do the medical exam.
Right, that's what I said. The court did not require it, right.
And there was one that was ordered, in fact, right?
There was...
All right.
What's happening here? Okay, this is just them. This isn't me.
All right, so the last thing you talked about was the Goldwater Rule.
Yes, sir.
Been around for almost 50 years, right?
Yeah, I'm 59. That sounds about right.
Yeah. And it's been around as a result of a presidential election that you referenced.
Yes.
And who has that rule? What organization maintains that rule?
The American Psychiatric Association.
An association you're a member of?
Association that I'm a member of, yes.
Aren't you a fellow or something?
Yes, I am.
Okay, the Goldwater Rule. The Goldwater Rule is a statement of ethics first issued by the American Psychiatric Association in 1973, restraining psychiatrists from speculating about the mental state of public figures. Interesting. Okay. The rule enjoins psychiatrists from professional diagnosing someone they have not personally evaluated. Okay. So this makes sense. So it's a rule that doesn't let you evaluate somebody that you've never talked to. That's basically it. The argument here is that, like, okay, because it sounds like it'd be irresponsible. Right? So it's basically what it's saying is, like, you can't speculate on, like, a psychiatrist or whatever can't speculate on my mental health because I'm a public figure. I'm not a big one, but I'm literally very large, but they can't speculate on my mental health without actually evaluating themselves. Right? And so I guess what they're trying to say is, like, hey, you didn't evaluate Johnny Depp, et cetera, et cetera. Did this guy actually evaluate Johnny Depp at all? On, like, an independent basis? Okay, so he never talked to Johnny Depp personally. Okay, so this is a fair thing to bring up. I wonder why they brought him on in the first place then. Like, what was the point? Then why is he here? Why did the court even allow him to even weigh in on his testimony about Johnny Depp?
Okay, so, and this is an ethical rule, right?
It is an ethical rule. Yes, it's ethical. They say rules. It's an ethical guideline. Yes, they're guidelines.
Yeah, well, it's
And
still a rule.
You
yeah.
know that over time, the American Psychiatric Association has amended the rule, so it's not just about diagnoses, but it's also about professional opinions.
Could you be more specific, say, about professional opinion in regard to what?
Is there a video on not the cross-examination? Is there, like, a video where it's just, like, normal? Like, just, like, the... Okay.
Well, let me read this and see if you're familiar with it. It is unethical for a psychiatrist to offer a professional opinion about an individual.
Hold on 1 second. Okay, I feel like we have to watch this first. I think this is her talking about it, only because I want to understand why they even brought him on in the first place. Hold on. I just need to know, like,
Do you
what...
remember my question? Did you review the
reviewed
deposition testimony of Dr. Curry?
Dr.
Curry.
Yes, I've Dr. Yes, I'm sorry.
And-
Yes, I reviewed testimony of Dr. Curry. I reviewed Dr. Curry's reports. I reviewed Dr. Curry's testimony.
Okay, and what if did you review the deposition and trial testimony of Dr. Hughes?
Yes.
Objection, Your Honor, beyond the scope of the disclosure.
I'll allow that.
Thank you, Your Honor. Overruled. Did you interview Mr. Depp?
No, I did not.
Did you
Okay.
request to
I
interview?
requested to interview Mr. Depp twice, and both times Mr. Depp and his lawyers refused.
Okay.
Dr. Spiegel, I'm going to ask you some questions in this case respecting your opinions and the opinions you have formed and the bases for them. And I'm going to ask you to provide.
So, I mean, the obvious reason they didn't want him to interview, I mean, okay, I'm assuming they didn't want him to do like an analysis on him for a reason, because it would probably have hurt their case. Okay.
Provide me with, in a reasonable degree of medical probability or certainty. Can you do that?
Yes.
Okay. In a reasonable degree, you have formed and the bases for them. And I'm going to ask you,
Sorry,
respecting your opinions and the opinions you have formed and the bases for them. And I'm going to ask you.
Sorry, just give me.
Depp and his lawyers refused.
Okay.
Dr. Spiegel, I'm going to ask you some questions in this case respecting your opinions and the opinions you have formed and the bases for them. And I'm going to ask you to provide me with, in a reasonable degree of medical probability or certainty. Can you do that?
Yes.
Okay. On what were you
So, okay, so it sounds like what they're doing is they're going to ask about Johnny Depp's behaviors in a general way so that he can talk about them? Okay.
requested to analyze and opine in this case?
So it's fourfold. One, I was asked to opine about the risk factors that are associated with intimate partner violence and behaviors that are shown, risk factors that are shown in intimate partner violence to be consistent with behaviors that Mr. Depp has demonstrated. Two, I've been asked to opine about the acute effects on alcohol and substance use. And
I mean, okay, so it's just like he's asked his opinions on, that's opine means like hold and state one's person, like one's opinion. Okay.
that including mood, behavior, cognition, functional impairment.
Yeah, you see you going crazy in the chat, but that's, yeah, he seems to have only studied Johnny Depp's behavior based on the information that available. Okay, so here's the problem with what you're saying. He has only studied Johnny Depp's behavior with information available to the public and from the Pirates movie, which is unethical. Okay, it might be unethical, but okay, so the information available to the public is generally private information that's only been made available to the public because we're talking about this case. So it's not like he's not speculating on a public figure based on their public interaction with people. He's speculating on a public figure based on private information, like private, or the way that he interacts. Now, you could argue that that's objection hearsay because other people are saying it about him, right? I guess that's hearsay. But it's still not generally available information, right? It's not, you know, I'm using the pirate movies, yeah. It's not like we're just seeing like Miley Cyrus on stage riding a cannonball and going, "Oh my God, I'm a psychiatrist and I think that she's clinically fucking insane." It's more of like, okay, private people saying mannerisms like on a particular topic. So I think it's a little bit different. You can still maintain that you think it's unethical, but like, let's also keep in mind that like this is what I'm talking about, where it's like you're not necessarily wrong, but you're being very biased in like a particular direction. Okay. And the judge allowed it for whatever reason. So,
Three, talking about the psychological profile, if you would, of, is there a question? I'm sorry. Oh,
no.
Okay. Of psychological and medical sequelae of patients who have suffered intimate partner violence and perpetrated intimate partner violence, and whether or not Mr. Depp's behavior is consistent with that. And lastly, about alcohol and other substance use disorders, their diagnostic criteria, their medical and psychological effects, psychiatric effects, their cognitive effects, and their functional effects. And I think I would like to just go with the jury one other thing. When we talk about, when psychiatry talks about substance use disorders, it's imperative to understand we're not talking about someone who rarely uses and happens to have a bad night. We're not talking about someone who uses on a weekly basis and has a bad night. We're talking about repetitive patterns of behavior that meet a list of 11 criteria that could be deemed mild, moderate, or severe. Because I think people get confused when they hear the word substance abuse, that they think of, oh, I may have used this because I used it twice. There is a whole criteria of behavior and sequelae and consequences.
so I'm assuming he's talking about like chronic substance abuse. Okay.
Go with a substance use disorder. I'm not just talking about someone who will occasionally smoke a joint or smokes a joint or snorts occasionally coke, okay, or has alcohol on weekends. So I really need to reiterate that, because I think when you look at psychiatric behavior, we tend to people look online and say, my gosh, I have all 7 of these, right?
Well, oh my God, so true. People self-diagnose the whole time.
They're reading it not quite the way the psychiatric literature is supposed to go. So please, when I'm talking about this, I need you to understand, one, that's what's going on. As I told you about intimate partner violence, it's horrible that anyone would strike anyone, okay? But again, we're talking about repetitive behaviors for means of control. Right? So that's real important to understand when you're moving forward. And I may say occasionally substance abuse, but what I'm referring to is substance
Objection
abuse.
beyond the scope of the question.
I don't.
Sustained. Next question.
Okay. Dr. Spiegel, could you please just summarize for the jury the conclusions you came to with your opinions, and then we'll take you through the specifics.
So in my opinion, based on my a review of the evidence, based on my clinical experience, based on my publishing experience, based on my teaching experience, that Mr. Depp has behaviors that are consistent with both someone who has a substance use disorder as well as consistent behaviors for someone who is a perpetrator of intimate partner violence.
Thank you. I'm going to start with the impact of drug and alcohol abuse over time. First of all, based upon your review of the record evidence, what type of drugs has Mr. Depp used?
So Mr. Depp, and I'm talking about use, we're talking about a substance use disorder here. We're not just talking about use. Okay, so we are talking about alcohol, we are talking about amphetamines, we are talking about marijuana, we are talking about cocaine, we are talking about LSD, we are talking about ecstasy, we are talking about opiates, we are talking about prescription benzodiazepines, and we'll get into a separate thing about the abusability of Seroquel and or gabapentin and Neurontin. And we are talking about much of the time concurrent use, meaning simultaneously.
In your practice, do some patients suggest to you that drugs and alcohol actually help them?
So I think it's patients who lack insight or are in the very early stages of recognizing they have a quote unquote problem will sometimes actually say that they have this medication actually calms me down. This medication makes me feel better. And in actuality, they may not acutely feel anything, but chronic and continual use will take its toll on the brain. So the answer is yes, but again, people who have substance use disorders have lack of insight and a lack of judgment about what's going on. They're very poor moderators of their own behavior.
Has Mr. Depp suggested, based on your review of the record evidence, that alcohol and drugs actually help him?
Actually, in review of the evidence, he has suggested that alcohol, Xanax, I'm in the list of medications, do help. Although I will also tell you on review of the evidence that there were at least 2 times I can remember that Mr. Depp was referring to at least short-lived periods of sobriety, and I cannot exactly tell you what that included. That both times he said that he functioned better and that he recognized that alcohol and drugs was at the root of his problems.
Now, there's been testimony that Mr. Depp is quite charming.
So is that something that was made public, or was that information that, like, this guy, like, is that private information? Or was that public information? I'm just trying to talk about this Goldwater Rule. Because, I mean, either way, the rule says that you shouldn't be doing it if you haven't personally evaluated them. So it doesn't necessarily matter from that, I guess, that ethical perspective. I'm just trying to look at it from, like, it's like more of a gray area, I guess, if you have this private information when it comes to the speculation, but okay.
Both off and on the drugs and the alcohol. What is your answer to that?
So, again, let me put one thing clear here. I am not here to impeach Mr. Depp's acting skills or his persona. He has way greater skills than I do in that. What I'm here to say is talk about how drugs and alcohol affect what we all have in common. We're all human beings. We can all only get so much, take so much when something is going to happen. And that's what I see every day in the emergency room, on the consult service, and inpatient psychiatry. Bad things happen, not because of anything special, except we're all human beings, and our brains, substance abuse, are not titrated. They're not regulated by the FDA. We don't know what we're getting. We don't know how much we're getting. There is no control over what makes it to our brain. So it is not the actor. It is not the persona, okay? It is a person just like the rest of us who are human beings who will have these effects, and that's what we all share in common. Everyone in this courtroom shares that in common.
When Mr. Depp was in his relationship with Amber Heard, was he a polysubstance abuser?
Was he in what substance abuse?
Polysubstance
Yes.
abuser?
So
Can you explain what that is?
Overruled.
I'm sorry.
Okay.
Go ahead.
Okay, so polysubstance abuse is the use of 3 or more substances. And I answer, like I said, concurrently, he was. Even while I was getting ready for rehab on the island, he was. So, yes, he did engage in that.
Did Mr. Depp's drug and alcohol abuse affect him cognitively?
Yes. So, if nothing else to look at, Dr. Blaustein, a psychiatrist that evaluated Mr. Depp, did a mini mental state exam on him. And as part of that mini mental state examination, you're asked to remember 3 words and then come back 5 minutes later and repeat those 3 words. And in the meantime,
So it sounds like he's referencing other mental health professionals, I guess you'd say, diagnoses or rundown of Johnny Depp. Is that what he's doing right now?
while you're getting other types of testing for attention and concentration and visual, spatial, and language, so other things that are being tested too. Mr. Depp was unable to recall any of them, and that is very unusual for a 50-ish year old male. I don't remember how old he was when he took that. Generally speaking, that age group should be remembering 2 or all 3 of those words. One, I do know that his lines were also fed to him by earpiece. Again, affecting memory. I did see in video.
Is this where people are getting upset because he's using like his time on Pirates of the Caribbean? He's like, oh, I heard about he had his lines fed on earpiece. I feel like that has to be somewhat normal. Like, how do you? I mean, I feel like I couldn't remember lines. That's fucking insane. I could see why people would get upset with that. I don't think it's like a huge, like, oh my God, this guy's an idiot. I think that this is just somebody who doesn't understand acting. He obviously didn't grow up as a gay theater kid. So, like, that's his biggest crime here. Because I feel like lines are probably like, kind of difficult to remember, you know? Yeah, you do the same, exactly. I mean, the best argument I guess you could have is like, well, Johnny Depp is a career actor, so he should be good at, he probably developed a skill of script reading and should be better at it, I guess you would make that argument. I don't really know, because I feel like this, as a normal person that hasn't developed that skill, you probably see more of an issue. But all right.
Deposition about having to have questions, I don't want to say repeat as much as completely forgotten. So the answer is yes. And you know, any one of us who use alcohol and cocaine to that level of degree, and I'm talking about a severe level of substance use disorder, are going to have effects. It is inescapable because we all have brains that are malaffected by extensive substance use and potentially some. So
have we like reasonably established that Johnny Depp was like on a lot of drugs? I feel like we have. So I guess that's not like a super inappropriate speculation. Was he? It seems like the general understanding is that Johnny Depp was using a lot of shit. Okay.
Sometimes less, but certainly what we're talking about here is extensive.
I mean, I guess most actors do. A lot of actors seem to have a lot of fucking problems, huh?
What, if anything, did you observe from the record evidence about Mr. Depp having difficulty focusing, his attention span, processing, whether he could function as an actor?
So,
Objection compound.
Compound is only if it's overruled. Thank you.
So again, in terms of the acting part, we do know that he needed his lines fed to him for movies. Part of that could have been also due to, and I don't know which movie, and please forgive me about that, that he actually confessed he did a movie entirely wasted. So I imagine it would be harder to do that. Additionally, like I said, when I looked at deposition, you can tell that the processing speed was down. His thinking rate was down. If your thinking rate is down, and I'm not talking about, again, I'm getting older. I'm probably not as sharp as I was at 25, okay? But I'm talking about it so slow that when we're trying to move on to other questions, we're still trying to answer the original data that's presented to us. So attention span is very much impaired. And if your attention span is impaired, your memory is going to be impaired. It is inescapable that that's going to happen. So all that comes into play. And that's what I witnessed in the video deposition. Fortunately for Mr. Depp, I do see that during this trial, his cognition has improved somewhat, which will happen if you are sober. So I commend him on that. But again, I'm specifically referencing the time with Ms. Heard's and Mr. Depp's relationship. So we're talking about that.
What, if any, observations from the record evidence did you have about Mr. Depp having alcoholic blackouts or foggy mind?
Again, there were reported times where he would be essentially, quote unquote, passed out drunk. You saw pictures of him passed out drunk and not being able to remember what he did, which is, again, if you look at the record evidence, you will see that, and this is linking intimate partner violence and substance use together. I know we're going to get to that, which is basically, if you have blackouts and you're using alcohol or using cocaine, it's going to be near impossible to remember what happened the night before. I don't think I'm the first person that's ever told you that alcohol can cause blackouts. And basically, alcohol decreases a brain chemical, glutamate, which is involved in memory formation. If it blocks that, to an extensive degree, the individual cannot remember what happened because they didn't have enough time for their brain to process the memory. You need this brain chemical. So does alcoholic blackouts happen every time? So no, of course not. But are they a complication of a use disorder? Absolutely yes. And there was record evidence of that.
Dr. Spiegel, you said at one point alcohol and cocaine. Is it possible to have blackouts with alcohol and different types of substances?
Yes. So my clinical experience, and I'll date it back within the last month, we had a patient who was using both, especially cocaine, and she had these kind of stroke-like lesions around the brain center known as the hippocampus, which is involved in memory formation. So
Objection relevance.
Just giving an example. Overruled.
Combining the two substances together increases the likelihood, even if you don't get what is a major stroke. And again, we think of a major stroke as someone who has speech difficulties and movement difficulties. There's a lot of different types of stroke that can just affect cognition. They don't necessarily have to have severe movement deficits or severe language deficits. They can solely affect you in terms of your cognitive symptoms, and actually known as a vascular neurocognitive disorder. So you need to understand, that's part of the psychiatric diagnosis. You need to understand that you can have these insults, these lesions, these strokes, without demonstrating physical features. And at a minimal, we know that he was using both substances concurrently, and at a minimal, we know he had cognitive issues that we talked about, or at least had some of them.
Thank you, Dr. Spiegel. What, if any, correlation is there between domestic abuse, heavy alcohol abuse, and cognitive disorders?
So, the risk factors, if you would, for intimate partner violence, okay, and there are probably many of them. I don't have time to go over all of them, but the ones in particular, the characters in particular, are one, having someone in the relationship who is jealous or suspicious. Two, having someone who has a higher than average acceptance of violence ideations. Three, someone who has rapid and extreme mood shifts. Four, someone who has limited self-control. One of the roles of cognition, one of the roles of our brain, is to prevent inappropriate behaviors and acting out on thoughts. We all get angry at people. That's human. We all get angry at people. We all think things about people. The difference is when our brains are intact and working well, most of us don't act them out. Okay? Most of us do not act them out. So that's because your frontal lobe and other parts of the brain are involved in making sure these negative thoughts don't get acted on. Okay? So, when you have the effects of alcohol acutely, it causes disinhibition, which means you are, by definition, losing control and having rapid mood swings. Two, you are affecting parts of the brain that are involved in what we call social processing cues. So you no longer can interpret what's in front of you that is, I would say, right or wrong, or what I should act on and what I shouldn't act on. So we act on them. Even though sober, and I've seen it with Mr. Depp's record evidence, I've seen it clinically, sober, we can contain that. We can contain that. But when you have these mixtures together, knowing, by the way, that about 40 up to 60% of intimate partner violence is done under the influence of alcohol and or substance use disorders, okay? Knowing that treating it gets it better, improves, I'm not saying removes it, but improves it. Hearing from Mr. Depp's own text to Dr. Kipper that he was better with that things are going better, will show you that given those confluence of factors, given them all lining up, the risk factors, combined with something that when any of us use to a certain amount, if we're novice at it, it'll be a lot less. If we're more experienced and have more tolerance and dependence, it's going to take a lot more. But inevitably, will make us disinhibited and will make us act out. And acting out could be done in a lot of different ways in intimate partner violence, okay? With also remembering, control is the end game of intimate partner violence. So that's how they basically interact in a nutshell.
Ms. Butterhoff, I assume you have...
I have quite...
Okay. All right. So now I'm understanding a little bit more where they're doing this like Goldwater Rule from. I wanted to get that context. All right. Let's get this other thing on there.
Based on publicly available information without conducting an examination. That's the rule, right?
If you're reading it directly, I will believe you.
Okay. However, a diagnosis is not required for an opinion to be professional. So my question is, it's not just diagnosis that this Goldwater Rule applies to, it's professional opinions.
So again, I'll reiterate that would come down to essentially nullifying witness testimony, expert witness testimony, without direct evaluation. And as we know, it didn't happen. But
okay, I see what this guy's... Okay, so the Goldwater Rule prevents you from like speculating as a doctor without doing an examination first, which totally makes sense. But his argument is like, okay, but you wouldn't let me examine. So their argument is like, okay, like my analysis could be different if you would allow me to interview your particular witness. And they won't let them do that. So we're kind of at like this, it seems like, now they might have an argument of like, oh, maybe he's biased. Maybe he is. It doesn't really seem like it from what I listened to. He seems like a fairly objective person, this therapist. So I doubt that they said like, oh, we don't want to consent to that because he might be biased. It sounds more like they just didn't want him to be able to have a professional diagnosis, because it would most likely justify what he's saying. I'm just saying that's what it sounds like. Now, just because what he's saying might be true about Johnny Depp doesn't mean that Johnny Depp can't be a victim in this situation. Let's just keep that clear. Let's keep that in mind. But because that would be like saying like, oh, somebody who's like on drugs like can't get like can't be abused in some capacity, right? Like it's like, oh, you couldn't have gotten sexually assaulted because you were drunk. You know what I mean? Like you can't say shit like that. That would be invalidating. But it does sound like they weren't super open to. It doesn't seem like they were super open to letting him evaluate. So that's the argument there. Okay, I get it now.
Regardless of that, the whole expert witness testimony thing would be basically rendered null and void.
The rule, in fact, contemplates that issue, doesn't it, sir?
Again, I'm just telling you the answer to the question. When you were reading me those statements, I'm telling you the response by the other side, who was published also, is that if that was the case, there could be no expert witness testimony in the courtroom.
Psychiatrists are ethically prohibited from evaluating individuals.
I do think that like, so what it sounds like they're saying is that nobody was allowed to evaluate Johnny Depp's mental state. I mean, that does seem like you're trying to hide something. I'm just saying.
Without permission or other authorization, such as a court order. That's the rule, right?
Again, if you're reading that, then I have to believe you're not misrepresenting it. And I would come back to, again, then this whole thing on we might as well get rid of all the expert witnesses we've had throughout all the time for court proceedings. Because what you're saying is unless a court orders it, and that's what you just said, or the APA said, then therefore expert witnesses cannot do an evaluation based on an observation of the medical records. Insurance companies cannot do evaluations solely based on the medical record with our doctors rendering professional opinions. So at the end of the day, you are essentially saying that unless someone has directly evaluated it, this whole medical system we have, this whole legal system we have, is null and void.
I'm not.
No, I tend to agree with the guy. I understand what he's saying. I mean, I tend to agree with him. Yeah, there seems to be like a rule that you shouldn't really speculate, but they do have private information. They're not just speculating on his like public figure. They're speculating on like all the publicly available information. Like, okay, I mean, I know you people are gonna fucking have an absolute mental breakdown after hearing me say that, but okay. And again, this guy doesn't seem biased at all. He's just saying like, hey, there seems to be an issue, a substance issue, which I think we all knew already. And then they wouldn't let him examine the guy, which, you know, of course they're not, because they want to win the case. But okay. I mean, I'm not shitting myself over it. It seems like he's being fairly reasonable here. Sorry if that upsets you. Yeah, but the fecal matter, true. Yeah.
No, yes, you are, sir. No, you are.
Give me a second, and I'll give you more than a second. What I'm saying and what I am reading to you is a rule by your organization that takes into account that there could be court orders that would permit the exact kind of evaluation that you say I'm eliminating.
And I think we're going in circles because I think I just said that means expert witness testimony would not be allowed, and the branch of forensic psychiatry would be especially hindered. And we know the branch of forensic psychiatry does not prohibit that. So I am a member of the APA. That doesn't necessarily mean every single thing they put in there, everybody has to uncategorically agree with, because clearly that's not the case.
Did you agree in your...
Well, I would imagine if you're part of the organization, you are supposed to, whether you agree or disagree is like irrelevant. Like you're part of this rule structure, you know what I mean? So like, I mean, that's a little bit of a silly thing to say. But okay, like I mean, like yeah, I'm part of America. Doesn't mean I agree with everything America does, but we still adhere to the laws. Okay, like I don't think that you should be arrested for stealing a candy bar. Like I mean, come on, guys. I'm just trying to get my blood sugar up. Okay, you know, but you know what I mean.
The deposition that the professional opinions you rendered.
Change the title to Depp Trial for more love from viewers. I don't know. I don't really like to use my Twitch as a way to get as many viewers as possible. I know that sounds so stupid. Like yesterday, I titled this stream "Balloons Master," and I didn't even play balloons. Like I don't. I just like to make it stupid shit.
Inconsistent with the Goldwater Rule.
Yeah, my first is inconsistent. If we're saying that if the Goldwater Rule says, and I very much
Cloud
said
form?
that during
Maybe
deposition,
one
that
day.
the Goldwater Rule was made for presidents and public figures such as that, but regardless of that, because that's what it was made for. It's not made for Hollywood, but I'll even take that Mr. Depp's a public figure. What I'm saying,
Well, I mean, he might be right about that. Well, that's interesting. I got to look into that. What was the Goldwater Rule made for? I'm curious about that. She should not be used as a platform for anyone. Okay. Unconsciously, he seems to destroy himself. Goldwater. Okay. Christ. Okay, it does seem to have started when it comes to the presidency. Okay. Why did they say public figure though? I guess they're being vague. I mean, does that necessarily matter? Who really cares?
to is that the Goldwater Rule is saying we cannot do any expert witness testimony in our field. That is exactly what the Goldwater Rule is saying based on exactly what you read. And I'm just telling you what you are saying that rule encompasses.
What I'm asking you, sir, is did you comply with the ethical requirements of the APA when rendering the professional opinions that you've rendered today?
It is a requirement of the APA. It is not the requirement of the APA. Secondarily,
so the
again,
answer is no.
Secondarily, again, in order to not, we wasted our whole morning because there was an expert witness before me. There's an expert witness everyone brought in. So all I'm saying to you, that means the whole field of medical legal law is corrupt and unethical for engaging in an act that the APA clearly says we should not do. So if you're saying that, then the answer is yes, I'm agreeing with that statement.
You're agreeing that the APA would deem your testimony and your professional opinions rendered unethical.
I'm saying you are saying that I'm an expert witness. I'm saying as an expert witness, and solely as an expert witness, that guideline is permitting that from occurring. I would say then that the whole field of expert witness testimony.
It's interesting because, okay, so that Goldwater Rule, because I'm still like thinking about a lot of this stuff. That Goldwater Rule seems to be specifically in reference to just like general speculations, but this is a courtroom speculation with the existence and the ability to do cross-examinations. So then that's different from just some psychiatrist making like a general statement in a way to invalidate somebody. I'm just saying, like, I know people are they're gonna shit their pants, but like, I don't know. I mean, what the guy's saying makes sense to me. Like, I don't necessarily disagree with him. Like, it seems fine. This seems to be like a reasonable speculation based on the information that he's given in a courtroom setting. We're not just talking about, like, if it was like, not for nothing, but if it was like, if this was the exact same thing was happening to Amber Heard, you guys would be like, no, it should be fine because she's abusive and she should, you know what I mean? Like, it's not, I mean, I'm just saying, dude. This is fun. I mean, whatever. And they have the ability to cross-examine and say like, oh, what you're saying is wrong, blah, blah. I don't know how relevant what he's saying. Like, it doesn't mean that Johnny Depp can't be a victim just because of this, just because he might have had a substance abuse problem. So I guess maybe that's where I'm coming from more than anything else. But okay.
Again, would be disavowed by what you are quoting in the Goldwater Rule. And we know that's not the case, because if it was, we would not be allowed to do it.
And you said the rule was for presidents, right? And
that was initially for presidents,
yes. And the name of the rule came from that. But the rule says it is unethical for a psychiatrist to offer a professional opinion about an individual. That's right, sir. It's not just presidents, it's not public figures, it's individuals.
Funny, it was named after them. According to your logic, if you don't put something in the title, it's not true. That's what you told me this morning, I believe, about my intimate partner violence. So what I would say to you then, sir, is that if you say this about an individual, again, any court would have to render an expert witness testimony invalid. Any doctor that reviews charts would have to render it invalid. I can go on the list of docs that do not see or interview patients directly, and that's a violation. So basically, you are saying that unless you do a direct clinical evaluation, then all of the field of forensic psychiatry and all of managed care is doing an unethical violation because we are not seeing the present. We deny patients medications all the time without seeing them. We deny patients treatments, unfortunately, without seeing them. And I'm on the receiving end of that. So the answer to your question, again, unless you were saying to me that all of this is unethical, which is what you were saying. This is how I'm interpreting what you were saying to me. That unless you do the evaluation directly yourself, Therefore, it cannot be considered ethical. And I'm telling you how that's applicable to not just expert law, but also managed care. It's applicable to multiple branches of medicine. Hospital duration of hospitalization stay, they get evaluated. So tell me where you want me to end this.
Well,
Sir.
why don't we talk about what you just testified to? Because I didn't ask you anything about that. I asked you whether, under this rubric, under this principle of medical ethics, have you acted unethically? Yes or no?
No. As an expert witness, I have not acted unethically. And if you want the jury to believe that expert witnesses are unethical, then I guess that's for them to decide.
Yes
that's
or no,
for them
sir.
to
You
decide.
said no. Let's go to the next question.
Okay.
Right? Psychiatric diagnosis occurs in the context of an evaluation based on thorough history-taking examination and where applicable collated or collateral information. You'll agree with that?
I believe I said that earlier, yes.
Yeah. And it's a departure from the methods of the profession to render an opinion without an examination and without conducting an evaluation in accordance with the standards of psychiatric practice. Correct?
Well, again, by the way, for the record, intimate partner violence is not a psychiatric diagnosis. I'll start with that. Substance usage by themselves is not a psychiatric diagnosis. If you want to cut to the chase, psychiatric use is not a diagnosis of that. Narcissistic personality traits is not a diagnosis. Ergo, I am basically commenting on the things that were brought to me, which are not diagnoses. But an evaluation, if I was going to treat a patient or anyone here, those are the steps I would take.
We, I think, started with the notion that this rule applies broader than diagnoses. It applies to professional opinions.
I believe
and
you
you've
just
rendered
quoted
professional opinions relative to narcissistic personality traits, haven't you, sir? Relative to Mr. Depp.
Again, I believe you just commented on what it takes to do in a psychiatric evaluation to establish a diagnosis. I'm almost certain that's what you said. And maybe I'm wrong. Maybe you didn't say that, but I'm sure you did. And therefore, what I'm saying is neither IPV nor substance usage nor narcissistic personality traits a psychiatric diagnosis. And then under the rubric of expert witness testimony, you are saying I acted unethically under the rubric of expert witness testimony. So if you, sir, would like to proceed that expert witnesses are unethical, based on that, I am not going to sit here and disagree with you and waste everyone's time. I think it's fairly obvious. So thank you. Go ahead. These were your words. I'm just saying back how they're interpreted.
Okay. Let's start with the easy question then. Maybe we can.
That was pretty easy. Go ahead.
All right, Doctor, you're going to have to just answer the questions.
Okay. Sorry about that. I haven't been getting into it.
You need to just answer the questions,
Okay.
Dr. Spiegel.
You are not rendering any.
I was like, what are you talking about? I guess it's because he interjected and said that was pretty easy, and they don't want the, they don't want the commentary. It's kind of funny. These two are really going at it. Interesting stuff. I mean, I guess that's why this is all public, because we all love a good shit show, huh? All love a good shit show. Oh, I'm just trying to get this monkey down.
Diagnosis whatsoever of Mr. Depp, today or ever.
Give me 1 second. I want to.
Any diagnosis.
Just answer the questions,
Okay.
Dr. Spiegel.
I just want to hear what they're.
You are not rendering any diagnosis whatsoever of Mr. Depp, today or ever.
No, I probably would say to you that certainly I would not say narcissistic personality, I would say traits. Certainly from what I have read, intimate partner violence is not a diagnosis. So the answer is no for that. Narcissistic personality traits is not a diagnosis. The answer is no. But if you want to tell me that substance use disorder is a psychiatric diagnosis, the answer is yes. And
But that wasn't an issue, was it? Whether Mr. Depp used substances. I mean, you said you've gone through the record. That wasn't really an issue at this trial. He's said it from day one.
Oh, so you're saying he's already admitted to the diagnosis?
He's already admitted to the use of the substances.
Well, again, there's a difference between admitting to substance use and substance use disorder.
Let's go back to what you just said about narcissistic personality traits.
Yes?
Narcissistic personality disorder is a DSM-5 diagnosis, correct?
Correct.
Diagnostic personality, and you haven't testified that Mr. Depp has narcissistic personality disorder, have you?
I would certainly, if I didn't, I'm certainly thinking that, but at least I'm going to say he has traits, which are characteristics of provisional diagnosis of, it's a provisional diagnosis, probably narcissistic personality disorder. But yeah, I mean, I do believe that.
Well, when you say provisional diagnosis, you know the DSM-5 requires, in order to find that diagnosis, 5 of the 9 factors. Mm-hmm. And you haven't done that analysis. You've never made that diagnosis. You've just identified certain factors.
That are criteria for the diagnosis.
Right. But you need 5 of 9 to get to the diagnosis. You've already told us that you didn't make a diagnosis. You're just identifying traits, correct?
I'm identifying traits that are consistent with the diagnosis, yes.
Right. And did you testify in deposition that the existence of traits, as opposed to the disorder, doesn't have a correlation with IPV?
If I said traits do not have a correlation with the, if that's what I said, and I don't remember saying that, but that wouldn't be a correct thing. Narcissism has a correlation with the diagnosis. Yes, that part's true.
All right, how far are we going to back this up? Because there's a diagnosis of narcissistic personality disorder, right?
Yes, sir.
And that one is has some correlation with IPV, right?
Narcissism has correlation with IP. Again, sir, you're not allowing me to answer. You're splitting hairs. You're splitting hairs between the traits that are consistent with, which all I'm commenting on is behaviors and traits that are consistent with the diagnosis and Mr. Depp. Narcissism absolutely has risk factors associated with IPV.
Let's go back again, and maybe we can focus on the question I ask you, and we can get an answer that's addressed to that question. Narcissistic personality disorder is a risk factor for IPV, yes or no?
Yes.
And you've
Hold on a second. IPV. What is IPV that they're referencing? Oh, intimate partner violence. Okay. Gotcha.
is a risk factor for IPV, yes or no?
Yes.
And you've previously testified that there is no literature at which you are currently aware that the mere presence of narcissistic traits is a risk factor for IPV.
Am I answering the question?
Yes.
That's incorrect.
You didn't testify to that.
Cluster B traits, which narcissistic personality disorder is part of, is a huge risk factor for intimate partner violence, which cluster B traits include narcissistic personality disorder, antisocial personality disorder, amongst others. So the answer to the question is every resource on intimate partner violence will support that cluster B traits, where narcissistic personality falls under, is a risk factor for intimate partner violence.
Any single trait is a risk factor for IPV.
Again, I will repeat, cluster B traits. I didn't say any trait. I said cluster. No,
Let me be more precise then.
Okay.
Any narcissistic trait in and of itself is a risk factor for IPV.
But you are mischaracterizing what I said. What I said, I'm pretty sure.
So he keeps saying cluster B traits. I don't know exactly what those are, but he's just saying that like traits within a particular cluster, I guess, in the diagnosis. So it sounds like he's being pretty clear. I don't know what the distinction or I don't know exactly what the lawyer's trying to prove here. But this guy's being pretty clear, and the lawyer just keeps repeating the question over and over again. I'm not really sure what is the expected outcome. What does he want as an answer?
I said cluster. If you look at all the intimate partner violence literature, and I would behoove you to do so, you will see that cluster B traits. I didn't say narcissistic per se. Cluster B traits, where narcissistic personality disorder is part of, are risk factors for intimate partner violence, part and parcel, uniformly true. And I'm not sure, the thing I don't understand is, I'm not sure why we're arguing psychiatry, because I'm telling you what it is.
Dr. Siegel, you just need to answer the question.
Okay.
So you want to talk about cluster B, so let's do that for a minute. Borderline personality disorder is a risk factor for IPV.
As part of cluster B traits, yes.
Histrionic personality disorder is a risk factor for IPV.
Less so.
But
Less so. Less so. I mean, it's a risk factor, but less so, yes.
Yeah.
Less so. Significantly less so.
All right. So which traits under narcissistic, before I move on there, there's only been one diagnosis in court of personality disorders, correct?
I'm not sure who you're referring to. Are you referring to Mr. Depp, Ms. Hurt? I'm not sure what you were talking about.
Do you understand that there was a medical examination done of Ms. Hurt?
Yes, I did.
Do you understand that the testimony was ultimately that Ms. Hurt suffers from 2 personality disorders?
Okay, so I'm just being specific. I just wanted to know if you're talking about Ms. Hurt or Mr. Depp. So that's all I was asking you.
Yes or no to my question?
Which was there's only one diagnosis of, Ms. Hurt was diagnosed with that.
Yeah, and both of the diagnoses are in cluster B, and both of them are risk factors for IPV.
But both those cluster B things are, I'm not allowed to comment on the testing, so therefore, all I can say is that cluster B traits, and I'll tell you what they are, and by the way, I testified this before, which was that One, I don't expect perfection from my victims. Two,
I don't-
absolutely there were cluster B
you're-
traits Ms. Heard had. Absolutely, Ms. Heard had.
Given that you've testified to it before, let's move on to a new question.
Okay.
All right. You indicated, in your opinion today, that you thought, well, why don't we move a little differently? Are you a member of the American Medical Association?
No.
Okay, so you don't know what the ethical rule of the American Medical Association is relative to doing clinical diagnoses about individuals you've never talked to.
So you're saying in terms of doing expert witness evaluations under that rubric, right?
I'm just asking you, do you know the AMA's rule?
You're saying the AMA's ruling under the rubric of not doing evaluation with somebody you did not see, and I'm questioning, I'm asking, so you are talking about expert witness testimony?
No, I'm talking about, do you know the rule?
I'm not a member of the AMA, so I
Okay,
don't
right.
read the rule.
We can move on. You don't know the rule. All right. You rendered an opinion about Mr. Depp's purported cognitive impairment.
Yes.
Yeah. What do you use as a baseline?
A baseline for processing speed?
Yeah, for analyzing Mr. Depp before you watched his deposition.
What do I use a baseline for that?
Yeah.
I mean, I guess my baseline would probably be how I've seen him interact in public. How I've seen him interact with others. I've seen him interact in media. I've seen him interact and his process speed is certainly not slow. I've seen him do commercials. His process speed was not slow.
At deposition, didn't you say that what you did was compare?
Okay, so all right, so that's like ridiculous. So if he's saying that his baseline for Johnny Depp is the way that he's seen interact publicly, and then like, yeah, if he is, I don't know specifically what he's referencing, like the courtroom or not, but if he's referencing the way that he interacts in like Pirates of the Caribbean, like, yeah, he's literally portraying a drunk character. I don't know if that's what he's trying to say. It's just interesting. Okay, or maybe based on the trial, what is his point of reference? Because he made a point about how like Johnny Depp needed to use what the fuck was I saying? He needed to use like an earpiece on a movie set, but it's like so are you saying that the way that he was acting on Pirates is like your uniform standard of him, or your current? It's just very. I have to hear more. Okay.
Mr. Depp's performance.
I mishear. Yeah. So what is it that he's saying exactly? Like what is it that he's comparing it to? That's what everybody's thinking. That's what people seem to be saying. So I'm trying to understand I'm just trying to understand what's going on.
Lots of pirate movies against his deposition testimony here.
What I said was I've seen Mr. Depp do apology ads. I remember he did an apology ad with Bad Dog with no delay in processing speed. I've seen him interact with the media regarding to that. I saw no delay in processing speed. All I'm saying.
Let me ask you about Pirates, though. You compared Pirates to the depositions given in this case.
And I apologize for what I said. Then I misspoke.
You misspoke? You didn't make the comparison?
Right now, just a second ago? Just a second ago, I may have said that I misspoke. I apologize, I misspoke.
Okay. Because you can't compare Pirates to sworn testimony, right?
Yes.
Okay.
But but as an aside, you can't judge someone's processing speed at any time. Like I'm judging yours right now, you're judging mine. We all judge processing speed as a baseline because of what we know about each other. I would say your processing speed right now is not slow. So, we're judging processing speed. I'm just saying to you.
Yeah. But no, any of Mr. Depp's other portrayals in movies, did that affect your analysis of processing speed?
Only I've seen him interact on interviews, and that was it.
Right.
When he wasn't in movies.
Right. But Willy Wonka doesn't matter to you?
Okay. So he's talking about it from the perspective of the way that he's seen him interact on YouTube, on interviews.
You see him in that movie, Charlie and the Chocolate Factory? Did you look at that one when you were comparing his processing speed?
Do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
No, you'll be happy to know I didn't see Willy Wonka.
Hold on a second. My mommy's calling. My mom will be here at 4:05. Great. Okay. Let's drop something off.
I didn't see.
I wouldn't answer that question either, though. Like he's obviously being facetious. Like what like a dumb question.
When Jump Street when it happened, whatever it was about. No, I did not.
All right. you made a very kind admission, I think, early on in your deposition, that you're not claiming to be a better actor than Mr. Depp. That's correct, isn't it?
100%.
All right. But with respect to acting, you know that actors actually rehearse for their parts and work on the language, diction, timing of their dialogue as part of that rehearsal?
If you say that, I'm not an actor, so I don't know what goes on. I can't tell you. I have no idea what goes on in acting.
Okay, but you don't know enough about acting to know whether actors rehearse?
Sir, I am not an expert in acting. I have no idea what an actor does.
I mean,
Okay.
I imagine you would know that they rehearsed, but okay.
During your deposition, what were the circumstances under which you decided to call Mr. Depp an idiot?
Under somebody call Mr. Depp an idiot?
Yeah, you called Mr. Depp an idiot in your deposition.
Oh, I think. Okay. So I think it was in the context. I think it was in the. You probably should read the context of it, because I think the context was, and I'm trying to think back. Okay. And what I thought it was related to was, if you're coming to some deposition, okay. And again, I'm thinking back. So you have it in front of you. I don't. So I'm thinking back where he's coming in from Europe for a deposition, video deposition that he gave, and he took it overnight the night before. And what I think I said was that if you're going to do a major thing or a trial that you're involved with, I think you'd be an idiot to come in the night before.
All right.
So I didn't call Mr. Depp an idiot. I certainly called that planning an idiot. I didn't call him an idiot.
So the words, so I mean he's an idiot, are mistranscribed?
No, I'm sure, again, if I said it in that, if you're just reading one line, one snippet, I'm sure it was in the context I just said. But again, you have it in front of you. I don't.
Yeah. Is idiot a professional opinion?
I wasn't rendering professional opinion.
Yeah.
No.
Is it a psychiatric opinion?
And that follows the Goldwater Rule.
How does it follow the?
I just said that I'm not rendering a professional opinion. I just said idiot. That's not a.
No, so idiot is not a professional opinion. Mm-hmm. Is it your practice to describe people as idiots?
In my practice, no, I don't describe my clinical cases as idiots or patients as idiots or victims as idiots. No, sir.
But you sat for a deposition in this case and described the plaintiff as an idiot, correct?
You gave me 9 hours of deposition, and if I said the word idiot, it was an idiot in planning. It wasn't making him an idiot. I don't know Mr. Depp's IQ.
Yeah, I mean, so that sounds like a fairly reasonable perspective. I don't even know the context of it. So apparently within a 9-hour period, he said something that Mr. Depp may have done would be in the context of you'd have to be an idiot to do that. Okay. But he didn't call Johnny Depp an idiot. I guess they're trying to establish that this guy just doesn't like Johnny Depp. But come on, like, you guys are being so unreasonable, because people are like, we called him an idiot. And it's like, it doesn't really sound like it. It sounds like you guys just, like, this is the problem. If you guys were more reasonable about your like, if you guys were like, yeah, you know, he broke like a Goldwater Rule, which is supposed to be like a standard practice, a part of his like thing, I could have been like, okay, that's fair. But like, you guys go, everything that this guy says is being taken in a context that he hates Johnny Depp. So you guys lose your objectivity here in a lot of this. And it just comes off as like, you know, you guys are just like doing anything and everything you can to defend Johnny Depp, even when he is doing inappropriate things. This is why we should be fucking weighing in like this on these cases, which I like, it's fucking crazy. A lot of people, bro, it's the same thing with like the fucking H3 thing where he's calling everything sexual assault. Like, it's the same fucking thing. We're turning this into like media attention on like a case about something that we're like, we really have no business in doing. Honestly, it's fucking nuts. But here we are doing it, and it's like it's for entertainment value for you guys. That's really all it is. That's really what it boils down to. That's the only thing that's been going on in the fucking news cycle for like the past how long? Like fucking months? It's crazy, you know? It's just fucking nuts. It's just insane, bro. It's just fucking insane.
I don't know his overall functioning, so therefore, if I said it, it was an idiot in planning, which is what I meant to come across as.
All right. So you did say you don't know his overall functioning, but you made some testimony today as to some evaluations you made relative to his functioning. You would agree with me that it's probably a good idea to think about the questions that are asked you in a court proceeding before answering them.
Am I allowed to answer that question?
Yes.
Okay. So what I said by functioning, I believe that his agent reported how late he was showing up to every movie while the cast is waiting for him. I believe that would be an impairment. If I showed up late for that, I would not be here right now. I would not have a job.
Yeah, 7 weeks. Yeah.
I believe the thing was in terms of balking out of treatment for substance rehab that his doctor is prescribing for him. So if you're asking me if that's an impairment of functioning, I would say I'm very much substantiated in that.
I'm trying to understand how you got to this notion of cognitive decline. And I thought it was based, at least in part, on the manner in which he testified.
I'm sorry, what?
On the manner in which he testified.
On the manner, I'm sorry, I'm not being difficult. I can't hear. I'm sorry. On what?
I was asking you about the cognitive decline testimony that you made.
Yes.
And it was my understanding that at least a portion of that testimony that you rendered was that you derived some evidence of cognitive decline from the way Mr. Depp testified.
Yes.
Okay.
And that's what I said, yes.
Right. And so all I'm asking you is, don't you think it's a good idea when you're in the middle of a court proceeding to answer questions carefully?
Again, professionally, we diagnose patients with a neurocognitive disorder by gross evaluation all the time with cognitive. On the thought that, again, age normal controls, I'm just saying, age normative controls does not put a 58-year-old gentleman at that processing. That's all I'm saying. That's all I said.
And you derived this without ever once talking to the man.
Me directly talking to him. Because we know how I derived it. So you're talking about me directly talking to him?
Yeah, you never talked
No,
to him.
I've never talked to him.
Right. And this exam you gave.
Right, and I believe it was because they didn't want him to talk to him, right? Like the lawyers shut it down, which makes sense. They want to win the case, but...
Well, you did talk about Dr. Blaustein, right?
Yes, sir.
You guys are crazy. You guys are like, oh, this witness sucks. He's doing a good job defending his perspective. It's an interesting thing because at the very least, you guys should understand how this person, somebody who's very clearly, very like he has done a lot of research in his field. Like this person would be offended and annoyed by some of these questions because basically the guy's entire like ability to function and like work is being questioned here, by somebody who has no understanding of anything when it comes to like mental health shit. Which, as a lawyer, of course, he's not going to. But it's bizarre how like you guys just hate this guy for nothing. Nothing he said warrants any hatred. It's fucking bizarre. You guys are fucking insane.
And you understand that the entirety of Dr. Blaustein's medical records are 12 pages of handwritten notes.
The important part was what I said. For me, as an example of cognition, which I'm trying to prove, which is what you asked me, the important part was what I said. And that was irrefutable.
The important part is that he gave the mini mental status exam?
Yes, sir.
All right. Let's talk about the mini mental status exam.
What is the mini mental?
Scored on a 30-point scale, right?
Yes.
All right. And it's an exam that basically is most often used for, Alzheimer's, dementia, those kind of testing?
It's an exam that tests cognition in all psychiatric illnesses, not just...
Yeah, I mean, if it's used for Alzheimer's, that's like your ability to, like your cognition, right? Like that makes sense. So Johnny Depp took this actual exam and he didn't do particularly well on it, and this psychiatrist or this therapist or whatever, this mental health professional is referencing that. That makes sense, doesn't it?
Alzheimer's. It was made.
A mini mental state exam is a set of 30 questions commonly used by doctors and other healthcare professionals to check for cognitive impairment. Your doctor might perform an MMSE if there is a reason to suspect you may be confused, such as after a bad head injury or during a sudden episode of illness, such as an infection. Okay, so it sounds like a reasonable test to reference.
For dementia, for Alzheimer's, but it is the standard, has been the standard for testing cognition in all psychiatric illness, substance use disorders included.
Okay. Now, there is an element of that exam that requires drawing, correct?
Yes.
So you don't know what drawing Mr. Depp did or whether the drawing should have been fully scored.
I wasn't questioning his visual spatial perceptual skills, which is what that does.
Right. And
Okay.
you don't
The
know
drawing doesn't matter because it's about perception. So, I forgot to upgrade that. Oh, well, I should have.
what score Mr. Depp received on the exam.
I was very specific. I know 3 words, not remembering at 5 minutes. That's all I said.
3 words, not remembering 5 minutes, and he remembered one of them, right?
From what I understand, you remember any of them.
All right. Memory on the exam. Out of the 30 points, what's it worth? 3. 3, right? Memory is 3 out of the 30.
Yeah, memory's 3.
Okay.
But again, the memory section in and of itself tests memory. That's the only question that tests memory. Only section that actually tests memory.
So the memory section tests memory. It's the only section you're testified about. And for all you know, that with respect to the exam that you're relying on, Mr. Depp scored 27 out of 30.
And that would be telling, though, cognitively, if you score 27 out of 30 and you miss 3 points on memory. That would be very telling.
You don't know if Mr. Depp had been up all night the night before.
Again, you wouldn't expect to not recall any words at 3 minutes unless there's a cognitive issue.
You don't know if Mr. Depp was high.
And again, now that could affect memory, but I'm not refuting that. I'm not refuting that at all. He could have been high, he could have been drunk, he could have been using cocaine.
Well, if he was high, why would you want to take this test? Are they trying to argue that maybe he was high so he didn't do well on the test? Because that doesn't seem like it would help their case, right? Because if he's typically high, then that would be his typical cognition, no? You know? Okay.
And that would absolutely affect his memory, which is what I said. Yes, you're right.
So ultimately, you have no idea what state Mr. Depp was in at the time he took the exam that you're relying on.
Short of what you just said about drugs and alcohol, okay, there shouldn't be a reason why a 58-year-old, also with strokes and other neurocognitive conditions, but short of that, there shouldn't be a really good reason why someone at that age shouldn't come up with at least one. But an answer.
But wait a minute, you started that question with short of drugs and alcohol and spent 35 minutes talking about his use of drugs and alcohol. Isn't that right?
Oh, I'm agreeing. I thought I agreed with you. I think I agreed. I said that drugs and alcohol can absolutely affect cognition. I'm not sure. I agree, but I'm not sure if that's a problem. I agree with you on that.
All right. So you don't know, one way or the other, how he scored on the exam. You don't know whether he was at the time on drugs and alcohol, but you're going to rely on it in your testimony to say that he's cognitively impaired.
Which is what we do in clinical medicine, sir.
Okay. You rely on tests that you don't know when it was administered, you don't know the score of the test, and you don't know the state of the person being tested, but you're going to rely on it anyway.
Again, if we had to know every test, when people get the mini mental state exam, we have no idea clinically if they are high, wasted, stoned, stroke. We have no idea. So if you're going to say that, that means everybody needs a drug test before they do a mini mental study, and that's not the standard of care. And I think you know that. So
let's talk a little bit about this word you kept using, correlation. You know the word, right?
yes,
Correlation and causation aren't the same thing, are they, sir?
no, they're not the same thing.
No, how are they different?
Correlation is consistent with causation, means direct link.
Can you say that again? You were so fast I didn't hear it.
Oh, sorry about that. Correlation is a risk for something happening. Causation is a direct link.
Right. So just because something's correlated doesn't mean it's going to happen.
100%.
Right.
100%.
Like lung cancer, for instance. Smoking is very highly correlated with lung cancer, right?
Yeah, and there's certainly a link
Right.
to lung cancer and smoking.
Right. But not all smokers get lung cancer.
Not all smokers do.
guess I
No
didn't
one,
have many
like I said,
people
no
as well.
one fits the curve perfectly.
Right. And you made repeated testimony to all of us. All of us do this. All of us do that. Mm-hmm. Your suggestion about all of us is you're just looking at the world as a sample and not at any particular individual, correct?
What I'm looking at is that I'm not talking about an individual, how they can or cannot be resistant. What I'm saying is invariably, when you use substances, this is going to happen. Now, is there a 0.05% chance that someone who does? Absolutely there is. But is that medical degree of certainty? Absolutely not.
A 0.05% chance of what, sir?
Of eventually developing symptoms. If you're using excessively, eventually you're going to develop symptoms.
All right. But risk factors tell us nothing about any one particular individual, do they, sir?
No, again, risk factors tell us nothing except that they have it, they're at a higher likelihood of developing it. That's
Right.
what tells us.
But you did a whole litany of risk factors relative to IPV.
Yes.
Right. And none of those risk factors tell us anything specifically about an individual.
Other than they're at higher risk. Right.
Right. So someone could have every single risk factor for IPV and never commit IPV, right?
It would be, again, if you're going to say a medical degree of probability, the answer is they will. But if you're saying uniformly, the answer is no.
Right. IPV can occur without substance abuse.
Oh, sure.
Someone can abuse substances without ever perpetrating IPV.
Again, absolutely. But, again, you are saying, different than what I said, I did not say abusing substances. I said substance use disorder. Those are two different things, because there are surely people who use substances that do not engage in any violence, do not become psychotic, nothing at all. So
and that's
absolutely.
equally true of people who have substance abuse disorder. There are certainly people who have substance abuse disorder who don't commit IPV, correct?
They are saying people who have substance use disorders, the majority of them, over 50% do. So over 50% do. So that's
the answer is yes.
As you said, not everyone who smokes gets lung cancer.
So there are significant numbers of people. You said it was over 50. So you'd say 40% of the people who have substance abuse disorder don't commit IPV?
And those are the ones that do not have IPV risk factors, right? So we're talking about people
Wait a
who
minute.
don't.
Isn't substance abuse disorder and IPV risk factor?
Oh, yeah. These are other people that don't have other risk factors, right?
But again, we're talking about people in general. You don't know anything about any particular individual as to whether anybody's going to commit IPV.
If statistics follow through, all we can say is more than 50%, 70% will. If you combine more risk factors you have, the more likely you're going to develop the illness. If you smoke cigarettes once, that might not correlate to lung cancer. If you smoke it chronically, that might. So that's all I'm
we're
saying.
talking about individuals here. You either have lung cancer or you don't, right?
If you're smoking.
Right. You either commit IPV or you didn't.
Oh, I mean, yeah, you either did or you didn't, yes.
Right. So you took some issue with me because I was asking about substance abuse generally, and you wanted me to talk about the disorder. I asked you earlier about narcissistic personality disorder, and you haven't made that diagnosis. You've just talked about the traits, right?
Yes.
And somebody can have these narcissistic personality traits and substance abuse disorder and never commit IPV, right?
So, along that line,
Right.
about 80 to 90% of people who commit IPV have a personality disorder. So the answer is less than about 10% obviously do not.
There are more close links with IPV for borderline personality disorder than narcissistic personality disorder. Correct, sir?
I'm not going to agree with that.
No?
I'm not saying there are more links. I would say to you there are absolute. If you're asking me there are links, the answer is absolutely. If you're saying to me more, I can show studies that yes, show studies say that has not been absolutely definitively correlated. No.
No.
Absolutely not.
MDMA. What is it?
Ecstasy.
Yeah. And what's the normal dosage of ecstasy for people who use ecstasy?
Again, I couldn't tell you the quote unquote normal dose because honestly speaking, no one knows what they're getting when they're using it, right? It's not regulated, so.
But the effects
Okay,
of
that
ecstasy
makes sense.
enhance sense of well-being?
At low doses, the answer is yes. I'm going to gather when you're using it at higher doses and develop tolerance, you develop the sympathomimetic effects, which are not so enhanced well-being.
Increased extroversion, that's a symptom?
Again, at low dose, you are 100% right. At low amounts, you are 100% right. It is an entactogen. We feel closer to people. That's what people who use it say. They feel close to people, warmth to people, 100%. But with continual use and higher doses, it could be fatal.
Right.
So that's not well-being. I don't know if I call that well-being.
So continued use at higher doses, MDMA can be fatal, correct?
Correct.
What if you took 8 to 10 tablets of MDMA?
What if you took again? You don't know what it's very hard to say that. You don't know what it's what's the word I'm looking for? Contaminated with. Okay, you can't just say, hey, let me just take 8 to 10 pure ecstasy and see what happens. That's not going to happen. So what I would say to you again, because substance abuse are unpredictable, they are not regulated. No one knows what they're going to. No one absolutely has any idea whether it's going to cause this empathic entactogen effect at very low doses, or is it going to cause the sympathomimetic, increase, it's like a stimulant, like cocaine, something we talked about like that. No one knows what's going to happen. It's not regulated. And no one knows if you're using with other substances either, like other stimulants.
Or if you mix it with alcohol?
Or if you mix it with alcohol. No one knows if it's going to be potentially worse.
Right. But this is a potentially lethal combination. 8 to 10 MDMA tablets and alcohol.
This is a potentially toxic combination.
Right.
Can it kill you? Yeah, it is a potentially toxic combination. That's true.
Ever heard of someone cutting off their own finger on MDMA?
Have I ever heard of it?
Yeah.
No, I can only give you one example.
Hadn't seen that one before. Okay. So, Seroquel, that one puts you to sleep, right?
If you want a phrase of barbiturate putting you to sleep, then the answer is yes.
Yeah, you heard Mr. Depp talking about sometimes being on the nod, right?
And again, I think I explained Seroquel very well this morning.
Good. I'm going to ask him a few more questions.
Oh, okay. Okay.
All right. You kept making references to street value. Why were you doing that?
Because that's why people with substance use disorder use quetiapine and Seroquel.
Say it again, I'm sorry.
That's why people who use quetiapine or slash Seroquel can get it sells on the street because it's so barbiturate-like in effect.
Right, but you said that Mr. Depp had a prescription.
There are many substance use disorder patients who have prescriptions for Adderall and quetiapine from their doctor, and that doesn't mean they're not getting high out of it. That doesn't take much. Doctors like to believe what patients have to say. They're not going to go in there being expert witness testimony. All I'm telling you is that in people who have substance use disorder, it is not uncommon, and the thought was initially that because quetiapine was not addicting, that it's safe to give in people with substance use disorders, when in fact, we absolutely know it has street value. Absolutely know that for a fact.
Right, but my point about this is you made a bunch of testimony about street value, but you knew at the time you made the testimony that Mr. Depp, in fact, had a prescription.
He also had a prescription for oxycodone and roxicodone. Does that count? Because that's also probably not a good thing.
I mean, it's so interesting, this interaction. Like, the doctor makes perfect sense. I don't really know what else you want to tell you. You know, they're talking about drugs. He's like, well, he had a prescription. Like, yeah, that doesn't mean you can't abuse prescriptions. And it doesn't, like, well, there's an entire class action lawsuit going on, I think, with oxys, where they were irresponsibly prescribed because they're, like, horribly addictive. And the drug companies reported that they weren't addictive. So, like, I'm just saying, there's nothing, like, the lawyer is doing what a lawyer is supposed to do. I get that. That's fine. But this guy's answers aren't bad. Like this guy is defending himself perfectly well. The fact that people think he's unprofessional is fucking beyond me. Your only argument so far is like, well, the whole ethical, like, Goldwater Rule guidelines, which makes sense. I get why you'd say that. But outside of that, there's nothing unethical or irresponsible about what he's saying. He's not even being like partial towards Amber Heard. He's being objective. I don't understand. And keep in mind that the lawyers refused to allow Johnny Depp to get, like, this kind of mental health evaluation. Why do you think that is? Well, it's because they don't want information against him, which is fine. But I mean, like, Jesus Christ, they won't even allow him to get evaluated mentally to see if he may have, like, these particular things, which is fine. You do you, but, like, it's a fucking shit show.
Just because you have a prescription doesn't mean that.
Mr. Depp would agree with you it wasn't a good thing.
Just because you have a prescription doesn't mean you can't abuse it.
No, I'm not suggesting you're abusing it. I'm just wondering why your testimony was in any way tied to street value when every single drug you referenced, Mr. Depp had legally.
Again, you can have prescription substance abuse, and we know that, correct? No, I shouldn't be asking that. We can have prescription substance use disorders, and that's not uncommon if you look at the opiate epidemic that we're living in right now. We can have that. That's not an uncommon thing. Unfortunate, but uncommon. Not uncommon.
So, Seroquel, I think you described as a sleeping agent when used off-label?
When I saw what?
Sleeping agent, Seroquel, when used off-label?
When used off-label, it's used. I can be used sleeping agent, yes.
Right. So, Mr. Depp's use of Seroquel could account for some of the photos we saw in this trial where he's asleep in a chair?
Again, what I would say to you is that if you have a substance use disorder, you are using it to be knocked out. Yes, I agree, but I'm not sure at the end of the day if she'd have vomitus over you either, because I've never seen Seroquel do that. So when he was passed out in the chair, he also had vomitus over him. I've never seen Seroquel do that ever.
Neurontin is another one of the drugs you testified about. That one's also prescribed, right?
Yes, it is.
And what's the prescription for that?
What's it used for? And what's its indication, or what's its use?
What's its indication?
I mean, its indication is for seizures. It may have one pain indication. Again, I'm not a neurologist, so I can't tell you exactly if it does. But it's chronically used off-label for pain. It's used off-label for anxiety.
Right. And what's its effect? That's another one that'll put you to sleep, right?
Well, yeah. I mean, sure, 100%.
Right. And you made reference to a picture. There's been testimony around that picture that Mr. Depp fell asleep with ice cream in his hand. That's not vomitous, right?
I was told it was vomitous.
Okay. You talked about the fact that Mr. Depp indicates that from time to time he uses an earpiece.
I read that, yes.
Okay. Did you read the testimony of Mr. Wyatt, who told you what was being pumped into that earpiece?
Yeah, I mean, if I remember right, I mean, I think it was lines, right?
No, it was music.
It was music, not a line?
Yeah.
Okay.
So if Mr. Depp was listening to music rather than being fed his lines, does that change your opinion as to his cognitive function?
If he was never fed his lines through the earpiece, which I know he was, but read he was, and that may have been that example, Mr. Wyatt may have said that it was music. I guess the question is, were you having the music during the actual talking of your lines? Is that what you're saying to me?
Well, you know, if you can do two things at once, that's a pretty high cognitive function, isn't it, sir?
You know, it's a very good point, actually. Divided attention is something humans have a lot of trouble in. Yeah. So, for instance, we have trouble driving and putting on using our cell phones and direct. So, divided attention humans actually are not very good at. I'll put that out there.
But Mr.
In general, not just Mr. Depp, in general.
But Mr. Depp is pretty good at acting. You acknowledge that early on.
Absolutely. Well, better than me, so I know that.
Because you don't act. In fact, you don't know about acting.
You're right. I have no idea about acting.
And you don't know how prevalent the use of earpieces are in acting.
Again, I know nothing about acting.
Irrespective of the fact you know nothing about acting, you've testified that Mr. Depp's use of an earpiece is somehow a cognitive deficit?
So if I was giving a lecture and
I mean, that's fair, because, like, why the fuck? Like I was saying before, I mean, I would need one. I don't know. Like, but I imagine that he has more than just the earpiece. I mean, they talked about the all that test that he took before and, like, a bunch of other factors, but, you know, okay.
Fed my lines, I would think there's a cognitive deficit. So and maybe I'm wrong. Like I said, maybe I could be wrong. Maybe Hollywood stars get lines fed to them through earpieces all the time, and I don't know. That could be said. It sounded to me to be unusual if you're doing a movie and you don't know the lines. But like you said, I'm just judging on what I do with lectures, and that would never happen.
If you gave lectures, you wouldn't use an earpiece, but you're not going to tell anybody how to act.
I'm sorry, what was the question?
I said if you gave lectures, you wouldn't use an earpiece, but you're not telling anybody how to act.
Right, I would not use an earpiece during lectures.
Right.
But I don't know what the standard for standard as Hollywood is for that. I have no idea.
Your testimony about the use of an earpiece, as maybe you were wrong. You're comfortable with the fact that you may have made a mistake there?
No, because I think in the basis of what I've read about it, I'm comfortable that.
Whoa, they got Gatorade advertising placements in here? Shit, what a trial.
I don't.
You think that they paid the doctor to drink the Gatorade? This is the most unprofessional part.
Believe that actors are routinely given their entire script through earpieces. I find that hard to believe.
Yeah, but not one whit of evidence that this ever happened here.
I guess what I said. I just said I find it hard to believe. I didn't say it. I said I find it hard to believe. That's all I said.
Oh, yeah, but what you found hard to believe, sir.
Yeah, really disgusting Gatorade flavor. Where's the fucking blue flavor? Because they're not like lemon. It's yellow. It's yellow, blue. You know what I mean?
Was that
red?
Every line of the script was pumped through an earpiece. Where did you ever get the idea that that occurred?
That's what I read, and the court review, the court evidence. That's where I got it from.
Right. And you know whether Marlon Brando used an earpiece?
Isn't he dead?
Yeah.
So the answer is no. He does not use one now.
No, I used the past tense. Sir.
You know, I know Marlon Brando did use an earpiece, but I think that there was a specific reason why.
Right. Again, I know nothing. I will concede to you, I know nothing about acting. I will concede to you 100%. If that is the standard and people are done that for acting, then I apologize and that was wrong on my part. If that's the standard, I'm wrong. I don't know.
Okay.
So, like, they're not. So, it probably isn't standard practice to read your lines through an earpiece, because the answer would have been like, yeah, you know, it's standard practice. All they're saying is they're just trying to put like some kind of reasonable doubt onto what he's saying, not actually counter what's being said. So, it's probably not standard practice. It seems like the fact that there are articles that are like, oh, here are actors who cheated, who were fed through their lines on an earpiece, and it was like cheating. I read that somewhere. Yeah. Okay, they didn't say cheat. I could have swore the article said cheating. Cheating? Yeah, that's right there. Right? And like the point is it's probably not that common. Now it's speculative, you know, left, right, up, down, and sideways. Maybe it was a tough line. Maybe they were on burnout. And maybe it doesn't. Right. Maybe it has nothing to do with any type of like cognitive issue. It could have been something else. But okay.
Let's go with that. No further questions.
All right. How long is your reading?
A bit. You may want to take.
All right. Let's go ahead and break for lunch then, ladies and gentlemen. Again, do not do any outside research. Do not discuss your testimony with anybody, okay?
Okay. What's left then? Oh, that was it. Okay. I mean, listen, ultimately, I understand. Like, okay, we need to understand that when you're in a courtroom and as a lawyer, your job is to be 100% right. That's the whole point of your job. Like, that's what you do. Amber Heard's 100% right. Johnny Depp's 100% right, according to their interpretation. And then you find middle ground. It's not your lawyer's responsibility to have like nuance in the other person's argument. You know, that's just the way the system works. Whether it's good or bad, that's up for another day to decide, right? So I understand why the lawyer from Johnny Depp's lawyer like pounded this guy as hard as possible. Of course, that's your job. But this guy wasn't a bad witness. Like, this guy did fine. All of his answers were reasonable. He was a reasonable person. So I don't really understand why there's so much of a meltdown. I don't really understand. I do understand why there was a meltdown, because people like don't want to look at it like in like a relatively impartial way. Yeah. Thank you so much for watching, guys, and another special shout out to all my Patreon and Twitch subs. If you'd like to support this channel further than you already have by just watching the video alone, go down to the links below where you can sub on my Patreon, which will allow you to get your name on this beautiful black wall. Or you can go to the Twitch page and you can actually use a free Amazon Prime sub, if you have Amazon Prime, to subscribe. Thank you very much, guys. Take care.